This program is being recorded. Dr. Lilly, we're ready when you are.
Okay, great. Good morning, everyone. We are now live for our event today. Thank you so much for joining us for our American Academy of Pediatrics Nevada Chapter Virtual Walk with a Doc Kids Time. I'd like to welcome all of our parents, kids, and fellow practitioners to our 2021 Valentine's Day edition Virtual Walk with the Doc. My name is Dr. Lilly Hidaji, and I am the Nevada chapter of the AAP Walk with a Doc coordinator. I am a pediatrician here in Las Vegas and co-owner of Oasis Pediatrics. Our chapter has been meeting now for almost 5 years every second Sunday of the month in Las Vegas. We coordinate kid-friendly talks on a variety of pediatric health topics and then enjoy an outdoor walk together. It's a great way to get outdoors, learn important information about the health of our kids, and have the opportunity to ask a local pediatrician or a pediatric specialist any questions you may have. Our chapter also helps coordinate this event for the Reno community. We normally join at the beautiful Springs Preserves outdoor venue most of the year, while during hotter months, we gather at Mount Charleston Visitor Gateway to escape the heat. Since we're keeping our distance and to protect ourselves and our community from this pandemic, we're holding our 11th virtual Walk with a Doc this morning, live streamed online. For our talk today, we are really excited to welcome Dr. Ashley Hoban. She is a board-certified pediatric dentist and owner of Summerlin Pediatric Dentistry here in Las Vegas. Dr. Hoban especially has a passion for patients with special health care needs. She's a Las Vegas native and an amazing pediatric dentist, and we are really excited to have her speak with us today. As Dr. Hoban starts her talk, I really encourage all of you to use the chat box to talk to each other and also ask any questions that she can answer at the conclusion of her talk. Dr. Hoban, we are ready when you are.
Oh, thank you so much, Dr. Hidaji. So I'm Dr. Ashley Hoban. Hi, everyone. Happy Valentine's Day. Thank you so much for having me today. So first, let's talk about why your teeth are important. They help you talk, they help you eat, they help you smile, and they also make your beautiful face the shape that they are. So we want to keep your teeth nice and healthy so that you can keep them for your entire lifetime. Do you all know how many baby teeth you get? Hopefully you get 20 baby teeth, and then you also get 32 permanent teeth. So this is my little friend Chomper, and as you can see, Chomper has 32 teeth. So this is what an adult mouth would look like. It's really important that we keep them clean because we want Chomper to be able to eat and talk and smile as he gets older. Do you remember how many times you're supposed to brush every day? Hopefully you do. In the morning, you should be brushing as soon as you get up before you even eat breakfast. And then at nighttime before you go to bed, the last thing you should do is brush your teeth, and then no eating or drinking after you brush. Flossing is also important because it scrapes the sides of the teeth where those little teeth germs like to live in between, and they're protected in between the teeth. So the only thing that gets in there is floss. That little string helps you because toothbrush bristles are kind of fat and they don't fit sometimes. Also, you want to be sure that we're brushing our tongue. Your tongue can also be a hiding spot for the germs in your mouth. So you need to be sure that you're cleaning it off every day. Flossing should be happening once a day at least, and brushing your tongue should happen when you're brushing your teeth. So let me show you on Chomper. The best way to brush is if you use little circles like this to get all the way around. That way it gets the pink part and the teeth part. So that pink part is called the gums. That's the skin that sits next to your teeth, and it's really important that we keep it clean. If you don't keep it clean, the little tooth bugs love to live in those little spots next to the gums, and they'll make your gums bleed. If the gums bleed, it means that the germs are getting stuck and that we need to brush better. Usually with a parent's help, we can do a really good job in keeping them clean so that they don't bleed. Usually after about a week, that bleeding will go away. Another way to make sure that your mouth and your teeth are healthy is to eat good food. So all the food that's good for your body and makes us grow healthy is also the food that protects your teeth and makes your teeth healthy. So things like fruits, vegetables, proteins, healthy fats, those are all the things that are really good for your teeth. So like apples, oranges, chicken, carrots, balanced meals like spaghetti and meatballs, eggs, cheese, and unsweetened milk and water are what are best for your teeth. So the things that are not so good for your teeth are all of the things that we consider almost junk food. So things you should only have sometimes. So like crackers, cookies, goldfish, fruit snacks, gummies, other candies, breads, you know, muffins, things like that. So sweetened milks, soda, pretzels, donuts, chips, and candy are the things that are not so good. So those are the things you want to limit. When the little tooth bugs get access to those things that we consider junk food, then they make acids which damage your teeth and can harm them. If there's enough acid, then you get little holes in your teeth, and that's what cavities are. So if you get a cavity, then it's really important that it be fixed. Most kids don't lose their baby teeth until the last baby tooth goes when they're around 12. Most kids start losing teeth around 6.5 or 7. So that's a long time span of keeping those baby teeth healthy in order for the permanent teeth to come in healthy. The better we take care of our baby teeth, the better the permanent tooth health will be. So it's really important that children visit their dentist twice a year to monitor hygiene, but also to check for cavities and give you tips on how to keep your little one's teeth healthy. So I hope that all of you are good at helping your children brush their teeth, and kids, you have to do a good job of letting your parents help you. If you have any questions, I'm more than happy to answer them, but please don't forget parents to help your children.
Great, thank you, Dr. Hoban. We have a few questions for you. First question is, why do we need to fix baby teeth cavities? So
baby teeth are like the placeholders for your permanent teeth. And so if baby teeth get infected, then it creates an infected space where the permanent tooth is developing, and it can sometimes have enamel defects on it, or it makes the permanent tooth go in a very different direction than it should go if the baby tooth isn't healthy.
Okay, excellent. Our next question is, at what age should I take the pacifier away from my infant?
So at the latest, you want to take away non-nutritive sucking habits, which are like thumb sucking if you can, but also pacifiers, by about 2.5 or 3. So if we have prolonged sucking habits, then it affects the way that your mouth develops, but also the way that your tongue functions.
Great, thank you. And our last question is, at what age can children brush their own teeth without an adult's help?
So kids should be able to tie their shoes and write in cursive in order to brush their teeth on their own. And so typically that's usually around 8 or 9 years old. Most girls, it's around 8, boys, it's around 9.
Okay, awesome. Thank you so much, Dr. Hoban, and to everyone who joined us today. That was a great talk. It's time for us to all now go on our outdoor walk. So we will stop the live feed in a few seconds, and I really encourage everyone to take their time to enjoy some physical activity outside. It'll be great to see any of you guys put photos up of yourselves walking together that can be posted on the Nevada AAP Twitter feed at AAP Nevada. Make sure to walk for at least 20 minutes, bring your water and sunscreen, maintain your social distancing, and of course, wear a mask. Our next virtual walk with the doc will be held March 14th at 10 a.m. and we hope to see you there again. Stay safe and healthy and have a great walk. Thank you again, everyone. Happy Valentine's Day.